Hey everyone, and welcome to the Rules of Thumb podcast with Dr. G. I'm your host, Nick Golinvaux, and I write a weekly newsletter on all things musculoskeletal health and longevity. That means fewer aches and pains and a better knowledge of what to actually do when they inevitably rear their ugly head. In this podcast, I will read to you my article of the week so that you can listen to it on the go. If video is more your thing, welcome to those of you watching on my YouTube channel. So, without further ado, let's get into this week's article titled, Are steroid injections for carpal tunnel syndrome a cover or a cure? You may recall that carpal tunnel syndrome is an extremely common and painful nerve compression syndrome of the hand in which the median nerve gets pinched at the wrist as it passes through an anatomic space known as the carpal tunnel. Mainstays of carpal tunnel syndrome treatment include nighttime bracing, because we all curl our wrists up at night, which pinches the median nerve, a steroid injection into the carpal tunnel, or surgery to decompress the nerve. Unfortunately, less invasive treatments like physical therapy or oral medications have not shown any significant benefit in treating this condition. But do steroid injections really work? There's one theoretical problem regarding the use of a steroid injection for carpal tunnel syndrome. Most of the time, carpal tunnel syndrome is not a result of inflammation. The exception to this is in rheumatoid arthritis patients. So is squirting a large volume of anti-inflammatory medication, for example steroid, into an already too small space really an effective treatment? Before we look at the data, a quick side note on the confusing language of steroids. I often bring up steroid injections as a treatment option for various ailments in my clinic, and I am then frequently asked by my patients, but what about cortisone? Is that an option? It's the same thing. Cortisone is one type of steroid. Other steroids you may hear of include dexamethasone, betamethasone, triamcinolone. While there are subtle differences, for this discussion, we will lump them all together as steroid injections. Okay, let's get back to the data. As a whole, I would rate the research we have available on this subject to be of average quality. What is lacking is a well-done study that keeps up with patients for longer than 12 months after their injection. This really means that science hasn't answered the question of, can a steroid injection cure carpal tunnel syndrome? All we can answer from 12-month data is the question, does a steroid injection make my carpal tunnel symptoms feel better for a while? And the answer in the short term seems to be yes. If you're following along on the article, you can see that this graph shows that it really does seem to work in the short term. Studies following the results of carpal tunnel injection show us that 6 weeks after injection, 79% of patients have sustained symptom relief. 3 months after the injection, that rate remained fairly high at 70% of patients who are symptom-free. At 6 months, the first significant drop-off appears, and at that point, the rate fell to 53%. By 12 months, the rate dropped to about 30%. In one study, only 33% of patients had not progressed to surgical release of their carpal tunnel, meaning the other 67% had already had surgery for their carpal tunnel symptoms. In another study, 31% of patients still had resolution of their symptoms from their single injection. So, if you've tried nighttime bracing for a few weeks without relief of your miserable carpal tunnel symptoms, yet it's not the right time in your life to recover from a surgery, a steroid injection may not be a bad idea. What is clear from the available data, though, is that the general trend of carpal tunnel syndrome is often a slow worsening of the pinched nerve over time, which means that a strategy of, hey, let's just repeat steroid injections when the effects wear off, can actually lead to a dangerous progression and possibly permanent level of nerve damage. When that happens, not even surgery can fix the numbness or the weakness you feel in your knee. So some takeaways from today. Carpal tunnel steroid injections provide reliable short-term relief in most people for between 3 and 6 months. Carpal tunnel injections are likely not a repeatable long-term strategy to use to cure carpal tunnel syndrome. So as with all things in life, we must evaluate what tools we have at our disposal and the expected efficacy of each tool, and then we choose based on the risk-benefit calculation. Hopefully this piece arms you with the data you need to help you make that calculation. And remember, you're calculating for you, not your neighbor, your friend, or your mom. Thanks so much. See you next time.